Daniel Charles, I'm gonna be president of you.
Hi, welcome to Small Tips in Pediatrics. I am Dr. G.E.R. Ramos, a consultant pediatrician, and I will discuss with you today a common complaint for which parents bring their young children, usually of 2 years or less, to see their pediatrician. Parents describe their complaints in different ways. They call it that the child is bringing up the feet or puking, or sometimes they call it vomiting. In reality, the child is having what is called regurgitation. We know it is regurgitation because true puking is very common in infants from the first day of life. These are frequent episodes of puking or regurgitation in otherwise healthy infants is what is called gastroesophageal reflux. Babies tend to puke sometimes after each feed, and this is a physiological event. Physiological meaning that is a normal reaction or behavior of the body for a certain age group. Now, regurgitation is normal in children within the first 18 months. However, it's not physiological beyond that age. And here is where we're going to discuss the red flags in children who puke. I believe that an important differentiation that we should make is what is the difference between true vomit and regurgitation. And it has nothing to do with the amount that the baby brings up. It has to do with the behavior of the baby immediately after the baby has bring up the feeds. By concept, vomit is the forceful expulsion of the gastric content, while regurgitation is defined as the passive expulsion of the gastric contents. Therefore, how you differentiate one from the other is depending on how the baby behaves immediately after the baby has brought up the feeds or the food. A baby that vomits immediately after will be upset, crying, miserable, and unwilling to feed. When the baby is just having a regurgitation, the baby is usually still happy, still playful, and more importantly, not in discomfort and willing to feed. Besides, usually when it is a vomit, it's a baby that is sick otherwise. So you will see either the presence of fever or diarrhea or coughing or belly puffiness. When a baby is having nothing but regurgitation, it's usually a healthy baby with no other condition, and he just keeps bringing up his feeds several times a day, but is still happy and playful. While understanding that regurgitation is a physiological and normal event in children less than 1 year and 6 months of life, parents need to understand that babies do puke often, sometimes after each feed, and babies can puke up to 12 times a day. It is important for parents to understand that the volume that the baby pukes and the number of episodes of pukings per day will get better once a baby passes 6 months of age, and it is expected that will totally disappear by the age of 1 year and 6 months. Perhaps the question you have is, why do babies tend to puke? And the explanation is simple. They are not fully developed. As you are aware, when we eat, food goes from our mouth to the esophagus and then to the stomach. The esophagus is that food pipe that is between the mouth and the stomach. Now, once that food has gone down through the esophagus into the stomach, it should not return back up. And for that reason, there is a muscle at the lower end of the esophagus called the lower esophageal sphincter. But in babies, that muscle is not fully developed. Therefore, the food tends to come up, and hence the regurgitation. This muscle starts working much better after 6 months. That's why the volume of the puke and the frequency of it tends to decrease. Also, after 6 months, babies are not laying down all the time, which is a contributing factor for a baby to puke. And the diet also changes from a liquid a diet with a more consistency. The texture changes. After 6 months, we add cereals, porridge, and soft food like pumpkin, Irish, that we crush, and that food which is more solid is therefore less likely to come up and cause puking when compared to formula or breast milk. By now you know that puking is physiological in small babies, normal. Now you know why babies puke. Now you have learned that puking is supposed to start getting better after 6 months of life and supposed to be totally gone by 1 year and 6 months of life. I will now give you some red flags. And these are the situations that if they are present, you should immediately visit your pediatrician because intervention is needed. Number 1 red flag is babies who develop choking, stifling, suffocation. Either they stop breathing or turn blue during a puking episode. Another reason of concern and red flag number 2 is a baby that pukes more than the food he keeps in his stomach. And you will know that because the baby either will be losing weight or not gaining weight as expected. Red flag number 3 is babies who present with recurrent episodes of wheezing, shortness of breath, pneumonias, coughing, or hoarseness. And this is because sometimes puke can go from the food pipe into the breathing pipe and the baby's lungs and cause these undesirable features. Red flag number 4 is if your baby, who normally puke and is always happy and playful, now is presenting other signs along with the puking. Whatever the sign, coughing, fever, shortness of breath, vomiting, diarrhea, or constipation, you should seek medical attention because these signs more than likely are not due to the puke. It is something else or a complication of an episode of puking. Red flag number 5. If the volume of the puking episodes or the number of puking episodes per day continues to worsen, especially after 6 months, is a cause for concern. Or if the episodes continue after the age of 2, is a cause for concern. Or if puking episodes that had stopped completely now return, it should be cause for concern also. There are many possible causes, which includes food allergies, cachexia, achalasia, hiatal hernia, or foreign bodies in the gastrointestinal tract. And finally, red flag number 6. If the baby brings up in the puke or regurgitation anything that is not digested food, for example, dark, black, like coffee grounds, or red, like blood, or green, like bile, or brown, like feces, is a great concern, and the baby should be taken to the doctor immediately. Your doctor will have to figure it out. Thank you for being here, and I see you in the next episode of Small Tips in Pediatrics.